Greetings. I'm Yvonne Stapp for Science for the Public, and I welcome you to Contemporary Science Issues and Innovations. Today, we discuss the issue of diet and health. As you know, the Americans have a disproportionate amount or levels of obesity, diabetes 2, heart disease, and several other conditions associated very often with diet. And we have the famous American high processed food diet. Our guest is a major authority on the subject. Dr. Walter Willett is a professor of epidemiology and nutrition at the Harvard Chan School of Public Health and professor of medicine at the Harvard Medical School. Dr. Willett has led some of the most prestigious studies on diet and health that he'll talk about today, and he is the most cited nutritionist internationally. He's received many awards, and he has written one of the major textbooks in the field and also several books for the general public on the subject of diet and health, which we'll be talking about today as well. We are very honored to have Dr. Willett. Thank you very much, sir, for joining us, and welcome.
Well, thank you, and good to be with you.
Okay, and Dr. Willett, I'd like to start with a little background about these very famous studies and a little bit about, if you tell us why these very long-range studies are essential in discovering these links. Okay.
Sure. The background to these studies goes back to the 1970s when I was just getting started in my research career. I had been interested in nutrition and health for a long time. And at that time, people were being given dietary advice, eat this, don't eat that. But when I started to look at the evidence behind those recommendations, I realized that there was almost no evidence. For example, people were told to limit eggs to very small amounts to maximum per week. But when you looked at the studies, there was really no long-term study that showed that people who ate more eggs had higher risk of heart disease, which you would think would have been necessary to make that kind of recommendation. So what I realized was that we really needed to do a different kind of study. And I had been studying epidemiology at that time, what we call chronic disease epidemiology, is looking at the causes of conditions like heart attacks and cancers. And I realized we really needed to apply those kinds of methodologies to diet and health, which had not really been done at that time. So we launched these studies of diet and health, actually piggybacked on the Nurses' Health Study, which had been started in 1976 to look at oral contraceptives and breast cancer risk among nurses. And nurses were chosen because it was realized that they would be able to report medical conditions accurately and also committed to long-term studies. So after some pilot testing in 1980, we administered a self-administered questionnaire to the population, and about 95,000 women who were in the study returned that questionnaire. So that was really the beginning of our long-term study in nurses. We've been following them ever since, updating diet every 2 to 4 years, and also collecting data on smoking, physical activity, medication use, pretty much everything we could think of that might be related to health, so that in the analysis we could adjust for those other factors when we wanted to look, say, at trans fat and heart disease. We also realized that after a few years that earlier life experiences were particularly important for breast cancer. So we added another 116,000 nurses, female nurses, in 1989. Now we're now enrolling what we call Nurses' Health Study 3. We have another 50,000 women who are enrolling now, and we added 50,000 men along the way because, of course, men have serious health issues that needed to be studied as well.
And was there a strong relationship between diet and these different kinds of diseases? You were able to establish that over these decades-long studies. Can you tell us what there was about diet and these diseases?
Well, we published, I think, a couple thousand papers, so it's a little bit hard to boil that down.
20 words or
But
less.
yeah, when we started, uh, there was a pretty good understanding or belief that diet somehow influenced heart disease, but the focus was entirely on saturated fat. So several things have evolved. What has emerged on one hand is that we've seen that diet influences the risk either up or down of almost every condition that we've looked at.
Wow.
And that's not maybe too surprising because of our body parts are all connected,
Yes.
and they have our heart has some of the same experiences that our brain does, for example. Uh, so that's been amazing. I really didn't anticipate the uh, breadth of the impact of diet. And even for heart disease, many of the factors that we thought were harmful were not so harmful, and some of the most important things showed up during our follow-up. For example, trans fat at the beginning was something that was really off the screen of the nutritionist. I was worried about it because just understanding from my background in food science that this could be a threat. But people were actually being told to eat large amounts of trans fat in the form of margarine and vegetable shortening at that time, thinking it was good for them. And so it took us about 12 years before we saw that, in fact, trans fat was far worse than saturated fat in the diet.
Okay.
So there are lots of things we've learned. We're still learning, and particularly we're learning about the impact of diet early in life and toward the later years as it affects our cognitive function and other functions late in life.
Yes. Dr. Willett, did you find anything about how you could reverse some of these problems, particularly say diabetes 2, obviously obesity, but some of these other health conditions if people transferred to a real diet, a good diet? Just very quickly about that.
Well, reversing is a little complicated.
Yeah.
We're probably best at preventing it. Then we can clearly prevent with diet and lifestyle about 92% of type 2 diabetes we've seen when at its epidemic. We can also reduce the complications by diet and lifestyle. Some of the damages we can't reverse, like with diabetes, if it's been around for a year,
Right.
for some years, the cells that produce insulin may actually be damaged or destroyed and not totally reversible. But we can make it better in most
Right.
cases, and sometimes the symptoms will disappear. So it's rare that we can totally reverse all of the damage, but we can make a difference anytime in the life cycle.
So the big message is preventive. You should start out with a decent diet. And on that, the American diet is often criticized. I'm not sure that we have a full understanding of processed foods, but you have come down hard on that many times. And when we talk about your book, we'll talk about that more. But briefly, what is there in the American diet, and specifically this processed stuff and red meat, that has this effect on health?
Yes, processing has been a huge problem, but it's not the only problem. As you can point out, that red meat, fresh right off the cow is too much of that is not going to be good for us either.
Right.
A lot of fresh potatoes in large amounts is not going to be good for us either. So in some ways, the American diet was unfortunate in it. We sort of brought across the Atlantic the Northern European diet, which was very much animal sourced. And there's a good reason for that. In cold climates where we didn't have transportation and preservation, to survive in cold climates, it was really good technology to live off of animals. You could graze the cattle, the cows in the summertime and make cheese and have that in the winter, and slaughter your pigs in January, things like that allowed people to live when we didn't have fresh fruits and vegetables most of the year. In fact, we also used a lot of salt for preservation and smoking for preservation. And that all worked pretty well if you don't expect to live past 50. But we have different expectations now. And for living past 50, that traditional, very local, relatively unprocessed diet is terrible for long-term survival. But then we've gone to make it even worse in many instances by processing. We've taken, for example, grains that are naturally in whole grain form, beneficial for us. And we remove the good part, and we actually, the germ and the bran, and we feed that to animals, and we feed to people the refined white starch, which has bad effects on our metabolic status and doesn't have all the benefits of the minerals and vitamins and phytochemicals. And then we took natural plant oils, which are healthy. Soybean oil, corn oil, rapeseed oil, and we partially hydrogenated that, and that made trans fat. And interestingly, again, that was a cultural trap because we wanted to take those liquid oils, which would have been acceptable in the Mediterranean countries because they were used to using liquid oils. But in the North, people were used to butter and lard. So we partially hydrogenated those liquid oils to make them look like butter and lard. And in the process, we destroyed essential fatty acids by the processing and created trans fat. And that was probably the worst disaster the food system, I think, has ever had, and I hope will ever have, clearly costing millions and millions of premature deaths because of trans fat. Interestingly, somebody got the Nobel Prize in about 2008 for inventing them, and it took us almost 100 years to discover it was a disaster.
Oh, that's very interesting. I didn't realize that. Yes. Okay. So these processed foods are disastrous, and you go over that really well in this book. But I'm not sure that people realize just how ubiquitous this is in our diets, because when you go into a grocery store, typically you have just tons of processed food of all sorts, and there's junk food, I guess we call it also. And that's what's available. And until fairly recently, people didn't know there was necessarily an alternative, the importance of fresh or unprocessed foods. But this diet that is everywhere, school luncheons, cafeterias everywhere, and so on. Do you have any idea, like, whether the public is changing in its attitude toward this? By this, I mean a lot of the fast foods, the stuff that are fed to cafeterias to kids and everything else.
Mm-hmm. Well, there's some progress in some fronts, and like so many things in our society, we're going in two directions. People who have education and adequate money and resources are taking advantage of this knowledge, and their diets are getting healthier. You see them buying more naturally produced foods, more fruits and vegetables, cutting down way back on red meat, avoiding large amounts of sugar and these unhealthy processed foods. But unfortunately, many people, not all, but many people with low incomes are in places where they don't have much choice. These highly processed foods are often very cheap because sugar and starch are very cheap, and you can make a lot of money as a producer by just packaging them and adding some flavoring and coloring and lots of marketing. And so there's lots of families who, for multiple reasons, are still eating terrible diets that we know are the recipe for obesity and diabetes. A lot of them not having much choice. So it's, again, another example of the growing inequalities in American society. Yes. And it shows up in terms of diabetes, obesity, and you can draw the dots and connect it to premature death.
Right. We're seeing it now with disease also, like COVID. This is this hit this population over and over again, but it's never been clear to me that it has to be that way. There is plenty of money. There is plenty of food. It's a question of policy. It seems that, it could be corrected.
Yes, sometimes we absolutely could make it much better. Some issues are complex. They've gone on for generations, and they become healthy eating gets embedded in the culture. But there's massive profits that are being made all the way up the food chain because, again, the basic ingredients are so cheap, and there's huge, powerful industries that are basically feeding off of making people sick.
Yes, takes me to the next question. As a matter of fact, you have been outstanding in hitting on this problem of misinformation. and starting with regulatory agencies, for example, that we depend upon for advice. And so we have the Great Pyramid put out by the USDA, and so the food pyramid, and so on. You have taken that on, and you have also attacked articles that are clearly misinformation. And I mentioned one. I'd like to start with that and then go to the USDA issue. But an article, I think about a year ago in the Washington Post that cited a panel for research to show that red meat was really lots of red meat and other things were perfectly okay to eat. And you and several other well-known nutritionists attacked that. Thank you very much. Would you please tell us how that kind of information gets out there?
Well, that's an important issue. And this was, of course, exceedingly misleading that people were being told to eat all the red meat you want to, which, of course, flew in the face of not just our research, but virtually every recommendation that's been looked at by panels of experts. And I've described what I've called a disinformation triangle. And there's sort of three major elements here that feed on each other. They're not necessarily working directly with each other, but they feed on each other. Of course, there's the food industry, and you can expect that. Big beef, big soda, just like big tobacco. And they're using the playbook of big tobacco, basically publishing papers, buying off scientists, running full page ads, saying this is all about freedom of choice. And when they're in fact exploiting people who are vulnerable and have few resources and killing them prematurely and making them suffer in the meantime. So you expect that of big business. And they are very powerful in influencing the Congress. Basically, the Department of Agriculture is heavily influenced by these powerful economic interests. And just like big tobacco has been very influential in government. But then you also, another corner of the disinformation triangle is these so-called evidence-based scientists who make a career, and these were the people who were the authors of this paper in the Annals of Internal Medicine, which unfortunately has been one of the leading medical journals. It was really sad to see it corrupted in this way. So there's this little group of so-called evidence-based scientists who uses one of their tools, what they call GRADE, which insists that you have to have a randomized double-blind trial to have any reliable evidence. And that works for a new drug or something like that. But for nutrition, for diet, you can't really do double-blinded studies. And for looking at long-term health effects, it's virtually impossible to do randomized trials with tens of thousands of people and keep them on diets for many years. And so you need other kinds of evidence. If you only rely on randomized double-blind trials, you will basically throw out most of public health because you won't be able to look at environmental chemicals. You won't be able to look at even long-term side effects of drugs. You won't be able to look at environmental effects, climate change. Most of the really big important issues you can't study by randomized double-blind trials. And if you put on blinders and say that's the only kind of evidence that you'll look at, then you will be very, very ignorant. So you've got this group of evidence-based scientists who make their living and make their fame and get publications by this kind of report that came out. And then you've got, unfortunately, part of the media world that likes to sensationalize and get headlines. And every part of the media is under pressure these days because there's just so much competition for attention. And so the story about a dog biting a man doesn't get too much attention, but man biting the dog gets the headlines.
Exactly.
And so the public is getting, through the media, all too often a very distorted, limited, and unrepresentative view of scientific evidence. And the public says they're confused, but I would be surprised if they would not be confused because there is this really fragmented, really unbiased kind of information that they're getting. Even the New York Times is bad or worse than any of them.
Yes.
In fact, that's supposedly our best newspaper. But in science and health, they really fall down.
Absolutely.
They've run story after story, big front page stories even. It's good to be overweight or obese. And done
Yes.
some really poorly done studies that were reported. And then we published, and others have published far superior large long-term studies, including a compilation of over 200 long-term studies. And that got buried in a few words deep in the paper. So the public is not getting a balanced view of issues on diet and health for the most part. There's some there's some important exceptions, I might add, but
Right.
there's all too much of this sensationalism.
No, this is very true. The other part of that is that people, and when I say the general public, I mean professionals in different fields as well, that you wouldn't possibly know how these studies are constructed or how they should be unless you're a professional in that field. But we need much more input from the science community, I think, to try to help the public understand these things, since statistics are so important at everything anymore, and there is a great confusion, and sometimes a very deliberate one, with studies. So it's a real problem everywhere, but thank you for bringing that out. I'd like to ask you about what you have said about the U.S. You took the U.S. USDA on to try to correct some things, and you brought out some of the problems. You just alluded to the problem of lobbyists and of the clout of the food industry as it is. But would you tell us what you said about the USDA, which sets the standards, supposedly?
Right. This is a serious structural problem that we have in the United States, that the Department of Agriculture, which has many, many good scientists working for them and has done a lot of good work in improving crop yields and making our agricultural system more productive, but I must add, not always environmentally sustainable. So there's a lot of good science there, but they are very, but in addition to promoting American agriculture, then they have the primary role in setting recommendations for health. And that is often, it's become often in conflict. At one time in history, 50, 60, more than 60 years ago, there was serious undernutrition in the United States. And then there was a better alignment. People needed more food in general, some people did. Obesity was a minimal issue at that time. And so there was, in some sense, a better alignment of nutrition and agriculture at that point in time. But now agriculture has changed to become huge commodity crop production that's very powerful politically, and obesity and diabetes have become the major kinds of health issues in the United States. So now there's attention, and the powerful forces in the Department of Agriculture are big beef, big dairy. They have specific offices there that promote the production and consumption of those products that are often very much in conflict with the scientific evidence for health. So there's this built-in structural problem. And then I must say, the scientific community went off track too for a while in promoting it bought into the idea that all fat is bad for us. And that we realized the evidence just wasn't there for that. Again, like we realized the evidence for all the focus on saturated fat wasn't there, or eggs wasn't there. And there became almost a bandwagon effect promoting reduction of all types of fat. And what the evidence has shown really, I think from the beginning, and we added a lot more evidence, is that the type of fat is what's really important. There are good fats and bad fats, and the same with carbohydrates. There are refined starches and sugar, which are definitely not good for us, but then whole grains, high fiber, less processed kinds of grains can actually have health benefits. So for about 20 years, the focus was reduce all types of fat and load up on carbohydrate. And of course, parts of the food industry love that because
Absolutely.
those starches are so cheap, and you can make a lot of money. And that pretty clearly contributed to the huge surge in obesity that we've had. Multiple factors contribute, but unfortunately, taking our eye off of the quality of fats and the carbohydrates was really a mistake.
Right. That takes us directly to your book because you really took on the industry. And the book is, I have a copy here. Mine is quite beat up. Is yours prettier than mine?
I do have a copy here.
Oh, well, that looks nice.
Right.
Mine looks like this. It's all ratted
That's
up.
exactly the way it should be. Thank you.
But and we'll put information in the video about that book. But I do want to tell people in a very unbiased way, get this book because this has lots of information. It's very important. I don't know if this was part of the project of taking on the USDA and the great food pyramid that was so misleading and the food industry. And it's interesting that we call it industry because it is that. But the book I want to go into some segments about that, but one of the important things, well, two very important things is that you took on this thing that had passed for basic knowledge about diets. You took that on before and in the book, and this is very important. And the other is that you made an additional connection in addition to all this information, the connection between a healthy diet and a healthy planet. And I very much appreciate that. You were way ahead of the field on that one. So let's go to the book then, if you will. You critique the USDA in there, and I hope that people will read that. But the other thing is the diet components, and you've already talked a little bit about the fats issue and so on. The book provides just excellent information, very readable, very accessible on these components of a diet. So could you tell us what are the good components of a good diet?
Sure. And this was a challenge. And I must say, note that science writer, gifted science writer, Pat Scarrett worked on this book with me to
Yes.
take my more or less sort of dull, boring scientific kind of writing and liven it up a little bit.
It's very good. Yeah.
That was a lot of back and forth between the two of us. And I must say I was very happy that we did get several awards for scientific writing on that because it did take a lot of work, more work than I thought it was going to be, working to boil down, again, massive literature into the most important points that are important for people to know if they're interested in their long-term health.
Yes.
So the basic components here are can be broken out several ways, but we looked at types of fat, and that's very important. The forms of carbohydrate, the sources of protein. These are sort of the big building blocks of a diet, and it's really what we call the protein package that's probably more important to consider than just the protein per se, because a protein from red meat comes along with a lot of saturated fat, a lot of cholesterol. Protein from nuts and legumes comes along with healthy fats, lots of fiber, lots of minerals and vitamins. We also looked at dairy as a component, which partly because, again, our traditional Northern European type of diet has dairy as a prominent part culturally. And we've been told that we need 3 servings of dairy a day. The evidence really does not support that. Populations around the world can be very healthy with no dairy per day. But I think there is some room for modest dairy consumption. But 3 servings a day is both unnecessary and can cause some harm. There's pretty clear evidence of an increased risk of prostate cancer, for example, with 3 servings a day. And interestingly, that high dairy consumption does not reduce fracture risk. They may actually increase fracture risk a little bit, especially consumed in large amounts during adolescence, because it does make people grow taller, but being taller is actually an important risk factor for many types of fractures. So ironically, the situation is the exact opposite, it looks like, of what people have been told. But like many things, it's not all or nothing. And again, I think having one serving a day of dairy is reasonable. Now, then, of course, we looked at fruits and vegetables, which are very important for good health. And taking a little bit deeper dive into the specific types of fruits and vegetables. And that's one of our active areas of research at the moment. We've sort of thrown them all in one basket, but what does carrot have in common with a head of cauliflower in terms of nutrition? Almost nothing. And so you would expect them to have the same health benefits, or what's in common with a cucumber. Again, almost nothing.
Right.
So there's no magic. Fruit or vegetables, and a variety is important. And we've covered some of the key types of fruits and vegetables that you want to be sure to include in your diet.
Right. That's by the way, very important part of the book. I just want people to know that there are lists there that give figures about, the nutrient percentages of these different foods. It is really invaluable. It's terrific advice. Thank you. Go ahead there.
Yeah, and we've talked about beverages somewhat too, because that's where we get a lot of calories. And in terms of adverse effects on diet, the evidence that we and some other people have put together really do show that sugar-sweetened beverages are, if you had to say one bad thing about our diet, it is the very large amounts of those that we drink. There's no nutritionally redeeming value. And now we see and documented lots of harms. We knew, dental cavities were a problem, but that's far beyond that. So we've gone into coffee and tea and other alternatives, alcoholic beverages. That's an important part of our diet that we often forget about in dietary recommendations. And we've talked about the role of supplements. I think there is some role, but they're not, of course, going to be an answer to unhealthy diets that would be perhaps filling in a few gaps that many people might have a hard time filling otherwise. So those are the basic elements, and it's not too complicated, but it's sort of, I regard this as an operating manual for people who want to have a healthy body and live a healthy life.
That's a really good way to put it, because people have a kind of one concept for fats, one concept for carbohydrates, and you've broken it down really well. Proteins, these things, you really need to know about it. And when I remember thinking, gosh, why don't they teach this like in schools, in high schools, so that people, before they go to lunch in the cafeteria and learn about these things? This is stuff we all need to know. We certainly want it for our families and so on. Dr. Willett, before we finish up, I want to ask a couple more things. You brought up just now the issue, the supplements. A lot of people feel like, well, if I just take this multivitamin and then go eat all this junk food, I'll be okay. Please tell us something about the supplements. How well do we absorb vitamin D supplements or multivitamins and so on, if you will, please?
Yes. There's thousands of different supplements out on the shelves in stores, and a lot of people spend a lot of money with them. Clearly, they're not going to be a substitute for a healthy diet. They contain essential nutrients, but they're missing a lot of phytochemicals and other components that we don't have in supplemental form. That said, I think there is a role for some supplements, but primarily just a multiple vitamin multimineral that you can get for about $40 or even $30 a year. You don't have to spend a lot of money on them. And this is more or less what I regard as a nutritional safety net, that you do your best you can to have a good diet, but very few people have an optimal diet, partly for sometimes for economic reasons, sometimes it's just too complicated, they're too busy for reasons that are out of their control. And so a supplement can be a safety net. There are some aspects of supplements that we can't get from our diet, and vitamin D is one of them. Mm-hmm. And that looks like a very important gap in many people's nutritional status. Again, most of our vitamin D comes from sunlight, and the fact that we live in northern climates where we didn't really evolve, and we now put on clothes, we spend our time indoors, we really disconnect ourselves from sunlight, which naturally generates vitamin D by contact with the skin. And then we have long winters where vitamin D levels in the blood go diving over the winter months. So supplements, I think, can help us maintain a good vitamin D status. I would add also that people who have darker skin generate vitamin D more slowly because the melanin in the skin blocks the sunlight, protects the skin actually from getting cancer. So it's actually good protection. But if you have darker skin living in a northern climate, then you're not likely to have enough vitamin D. But pretty much all of us, unless we're really outside a lot, get low during at least parts of the year. Interestingly, the UK now has recommended that people in general take vitamin D supplements just in the last couple of years. I think I would say for most people in the United States, unless they're out in the sun a lot or there's some unusual medical condition that they shouldn't be taking vitamin D, it's a good idea. And it's easy to get it in the form of a multiple vitamin. Just make sure there's an adequate amount.
Right. And a couple more things, pardon me, from your book before we leave that. The one that you insisted on exercise, and thank you for that. And we need that little reminder that just a good diet is not enough. But you brought up the exercise, which happens to be important at this time when so many people are staying in and sitting down and so on. So you talked about that. Weight control and exercise are very important components also, and the impact of setting. Do you have anything to say about that now?
You just said it.
Oh, there you are.
It's important to remind ourselves every day.
I was really pleased that you did say that, because most sources like this, when people talk about the diet, they don't talk about these other factors, but the lack of exercise, you've made quite an argument in the book about this, and thank you for that. And I want one more thing before we leave, and that is that you mentioned, and thank you very much, nutrition and the planet, how changing the way that we get food, it will make the planet healthier. Can you tell us about that?
Yes, that in the first edition of the book was just there is a small piece, but the issue has become so urgent that I added a whole chapter on our diet and the environmental implications. In some ways, this may be much more important than the direct health effects of our diet, because we can't really have a healthy human civilization if our planet is also not healthy. And there's an acceleration going on that climate change is happening more rapidly than any of us expected a couple of decades ago. So this is becoming a really urgent problem. Interestingly, the US Congress passed a law saying that the Department of Agriculture could say nothing in the dietary guidelines about the implications for planetary health or the environment. They were just censored. And the advisory committee had a whole chapter, it was censored. So it's really important to get this message out. Our food choices have a very substantial impact on climate change in the environment in many ways. Mainly, the biggest culprits here are cattle production, and especially feeding grain to cattle as we do in our industrial food supply. And so we really should be not necessarily eliminating, but substantially reducing our consumption of red meat, keeping dairy products on the modest side, and in general shifting toward a more plant-based diet. There's additional details about how we produce our food that are important, but these food choices can make a very big difference on whether we will pass on a healthy planet to our children and grandchildren or not. And we're headed to the not at the moment.
Yes. Well, it's a survival issue, but your book is right on top of it. And it's very, very wonderful that you put that in there, because big ag has been so destructive of the soil, of the climate in general, and so on. And I'm not sure that we're well aware of it, but you have spelled this out very nicely, and it's much appreciated. And thank you ever so much for writing this book. Please start a program or something, because there is such a need now for direct expert input for the general public, because you mentioned it. We have a problem that goes through the media filter, sometimes what comes out is very misleading. And you need the expertise and you need the people in science who can communicate really well, like yourself. That's much appreciated.
Thank
Dr.
you.
Willett, thank you very, very much for all this information. And I wish you the best with all of your studies. And thank you again for writing this excellent book as well.
Thank you for your efforts to get good science out. I greatly appreciate it.
Okay, bye-bye.